Welcome to the podcast, How to Be Well and Strong. I'm your host, Jacqueline Genova, and I'm excited to have you join me as I speak with some of the leading figures in the fields of wellness, integrative medicine, and mental health, as we discover what it truly means to be well and strong in both body and mind. Get ready to be empowered, inspired, and motivated about being an advocate for your own health. Welcome to today's episode on the How to Be Well and Strong podcast. We are going to be speaking with Dr. Mark Heisig about concussions, a type of traumatic brain injury that has gained significant attention in recent years. Despite the growing awareness, however, there still remains an alarming lack of understanding surrounding the true nature of concussions. Dr. Mark is a licensed naturopathic doctor who specializes in integrative neurology and functional medicine, striving to be a leader in concussion recovery and performance. As a former collegiate ice hockey player and competitive athlete, Dr. Mark has overcome concussion injuries himself and understands the drive that patients have to get back to sports and life. Welcome to the show, Dr. Mark. I'm so excited, as I just said, to be talking about this specific topic with you, particularly as the world of concussions and the recovery process is one that I've personally been very invested in since I've experienced quite a few of my own, and I know that you have as well.
Mm-hmm. Yeah, I'm happy to talk about it. Thank you for having me on here.
Absolutely. So let's dive right in. What exactly is a concussion, and what are some challenges in accurately identifying one? Since I've heard you say that by definition, a concussion doesn't necessarily show up on imaging.
Yeah. So if we were to define a concussion is a functional and transient form of mild traumatic brain injury. So if we break down like the keywords in there would be like functional, transient, and then MTBI, mild traumatic brain injury. It's functional, meaning that there is no true pathology present, which is why you won't see it on CT, you won't see it on MRI. At this point in time, we don't have a blood test or saliva test or anything to really say like this is concussion. We're getting closer to having those tests, those kind of panels to say, oh, this person needs a CT or not. But concussion is this functional injury, meaning it's not a pathology. It's transient, meaning it should go away over a certain time. And then it's a form of mild traumatic brain injury. Within traumatic brain injury, we have mild, moderate, and severe. And so mild, they're basically categorized based on like levels of consciousness, memory, orientation, things like that. So you could have, for mild, it could be like a moment of disorientation, no memory loss, no loss of consciousness, normal Glasgow coma score, so like normal alertness. And all that really happened was like a moment of wooziness, and then the headaches hit, and then the fatigue hit, or the whatever hit, and that's a concussion. Whereas like moderate, severe TBI, you're trending more towards coma, prolonged post-traumatic amnesia, stuff like that. So a concussion is this very functional injury, and the challenge is that it is functional. You're not going to see it on CT, MRI, things like that. So we've got to rely on mechanism of injury, symptoms, physical exam, things like that.
Interesting. So that MRI sophomore year of college that I had post-concussion was useless, basically.
Yeah. The only time we really look at MRI in like post-concussion cases is when we've checked all the boxes. Like we've looked at autonomics, visual vestibular, cervical spine, like all the stuff that we look at in concussion. If we've done all of that and you're still having problems, then we might reach for the MRI. But otherwise, for the most part, I think the actual number is like 99% come back clean, like no indication of anything. So
that's crazy. And does someone need to actually hit their head to get a concussion?
No, so that's a myth. So you don't need to hit your head to have a concussion. The kind of nerdy mechanism there is it's an acceleration deceleration injury. So it's when your brain is like shaking around in your skull and stretching and shearing. Again, not enough to tear or bruise because it's functional. But so anything. So if you think about the seatbelt across, like your car, you're in a car and someone rear ends you, you kind of whip forward and there's this whip of the neck. It's this acceleration deceleration force that gets transmitted to the head. So whether that's a blunt force to the head, whether it's a force to the body that kind of works its way up, or even when we think about like military folks and our veterans, like blast traumas. So like we call them like fluid pressure waves through the air, kind of like transmitting to the head. Anything that causes enough acceleration deceleration can concuss you.
Interesting. And I've heard you discuss those 5 buckets of concussion symptoms, right? So, like, I think it was like autonomic blood flow dysregulation, hormonal dysregulation, cervical spine dysfunction. Can we discuss maybe 2 or 3 of those that you've seen most commonly present in patients with concussions?
Yeah. So I talk about the 5 buckets. So all 5 would be like autonomic blood flow dysregulation, metabolic hormonal dysregulation, visual vestibular dysfunction, cervical spine dysfunction, and psychological kind of trauma, PTSD, anxiety, depression, whatever. I'd say the big ones would be autonomic blood flow, cervical spine, and then you always got visual vestibular issues. But I think one that doesn't get super addressed very often is kind of the psych piece. And I'm not saying that I'm like the guy for it, but I am very pro pointing it out and having folks get help for it. But the big one being like your autonomic bucket. So what that means, so autonomic is like your automatic, everything you don't think about. And after concussion, we see sort of this shift where uh, your autonomic nervous system is sympathetic, fight or flight, parasympathetic, rest and digest. And it's not an either or type thing. But what we see after concussion is that it's really easy to turn on sympathetics and kind of ramp up and have anxiety, faster heart rate, trouble sleeping, headaches, things like that. And it's not that the parasympathetic isn't there, it's just hard to turn that on as well. And so part of what we're looking at in the autonomic bucket is, can you tolerate gravity normally? Do you have normal steady state exercise tolerance? If you're an athlete, can we translate that to dynamic exercise tolerance? And that's one thing that I'll see folks go through. Like, I'm not going to throw any clinic under the bus, but like big name, like public clinics out here in Arizona where no one actually was thrown on a bike, no one actually was thrown on a treadmill, no one actually had orthostatic vitals testing. And that's one where if you can't distribute blood flow properly, nothing else is going to follow very well. And so that's one of the buckets that I love to kind of turn over and look at the most. And then after that, going back to kind of the acceleration deceleration piece, you can't have a concussion without whiplash. Like your neck is always involved. And that's another thing where I see these big clinics do really, really well at sending people to vision therapy or vestibular therapy or PT for just balance stuff. And no one looks at the neck and no one looks at exercise. And so those are two that I end up doing the most in my practice, is looking at autonomic tolerance and cervical spine issues. But then also having folks acknowledge that, hey, there might be some trauma or some pre-existing anxiety or depression, that it's not the cause of your symptoms, but it's certainly contributing, and it's worth finding a therapist or finding an outlet that kind of works for you.
Absolutely. And those two, quite interestingly, exercise and cervical spine, I was not even like made really aware of how important a factor they play until like maybe 6 or so months ago. But I know doctors used to dissuade a concussion patient, at least that's what I've experienced, from exercising and to rest following a head injury. But now new research has shown that exercise can actually improve recovery, primarily through like boosting brain blood flow to the brain. So to that point, I guess, do you recommend exercise following a concussion? Like, what is a safe time frame to begin exercising post injury?
Yeah. So I absolutely do recommend exercise after concussion. The timeline for physical activity. So a lot of doctors still do and used to recommend rest because that's what the guidelines said. We thought like, well, the brain is injured and we don't want to tax it. We don't want to like fatigue it out and actually kill neurons, or like fatigue something out to the point that we lose cells. And so the idea was, well, let's rest. And now, probably starting around 2013, 2016, that narrative started to shift, where we're finding that relative rest, meaning take it easy, but don't hibernate. Like they call it cocoon therapy or like dark room therapy. That's no longer recommended anymore. And we'd say just, hey, have some relative rest, take it easy, chill on the couch, maybe hang out with a dog, like do very light activity for like 48 hours. But by 72 hours, by day 3, you want to start doing like normal daily activities, loading, unloading the dishwasher, walking the dog, like just trying to do normal activities. But we call it symptom limited, meaning if you think about your symptoms on a scale from 0 to 10, pick where you're at. You could be like at a 5 or a 6. It could feel really terrible. That doesn't mean don't do anything. It just means don't go to a 7 or an 8 or like beyond an 8, right? So don't move more than 2 points on that symptom scale. And then from there, like structured exercise, we really can begin testing by day 5 after injury. And we see that when we do that, particularly there was a study, I think it was 2021, maybe 22, where we found that starting adolescents, so like a younger population, but starting adolescents on early aerobic exercise reduced their risk of PCS by like 48%. That's
Wow.
huge. And we see that consistently across different studies, randomized controlled trials, observational data, where early exercise results in faster recovery. We see that in animals and humans. And so what we're looking at kind of as far as like a timeline is we want that by the end of the first week, really, by day 5 to 10 at the latest.
Gotcha. And those like resuming normal activities, I'm assuming refers just to the physical aspect. So when it comes to things like looking at screens, computers, phones, is that stimulation also helpful, or do we still want to limit that as much as we can?
So not a ton of research out on screen time after concussion, but the research we do have tends to suggest that moderation is best, but you don't need to super restrict it. And I'm not a huge fan of one of the studies because, so like, I have my phone right now. If I go into the settings, I can see exactly how much screen time I have, and I can see which apps I was using. And this study used kids, and it said, "Hey, report back to us how much you were using your phone," which is insane to me because these kids could under or over report easily rather than just say, "Hey, send me a screenshot of your data." But anyway, that study found that kind of minimizing screen time in the first 48 hours was mildly helpful, but return to play times weren't all that different. And then another kind of review came out saying, hey, if you kind of restrict it a little bit, you might see outcomes, like better outcomes, but it doesn't really sway too much. So what I say there is with patients, I say, hey, for the first 48 hours, don't just spend it scrolling TikTok. Like take it easy, see if you can read a real book with pages, or, like kind of light activities not centered around a screen, but it's not going to be harmful to you if you do. The other piece there is sometimes screens are just triggering in and of themselves because of the refresh rate. So it's sometimes diagnostic to be like, oh, well, when you're on a computer, when you're on your phone, you have headaches or eye strain. But when you're reading a book or like a Kindle, you don't. Cool. Like it gives me more information. But for the most part, screens, we moderate.
Interesting. Good to know. Now I don't feel too badly because I remember I had my first concussion sophomore year of college. And the funny thing is, I didn't recognize that I had one until 2 days after the incident. But I spent the first 24 hours on the computer researching how do you know if you have a concussion,
Yeah.
symptoms of injury. My symptoms, quite honestly, didn't even present severely until 2 days after the actual injury. And then you just mentioned that you can't sustain a concussion without sustaining a cervical injury.
Mm-hmm.
What are your thoughts on chiropractic care following a concussion to assess whether there's been, obviously we know there's been some type of harm to the cervical spine. So what are your thoughts on adjustments post-concussion?
I think that they've got to be used sparingly. And this is not like, I'm obviously not a chiropractor, but I think that there's kind of got to use them sparingly. What I found most helpful with myself, and then I work with in an office with other physical therapists, so not chiropractors, but physical therapists. What I found is that soft tissue tends to be more useful than actual adjusting. Not that adjusting is bad. That's just kind of my clinical experience. Adjustments can be wonderful. But where I have caution with that and where I say use sparingly is especially in the acute phases. If there is a vestibular issue, if we haven't ruled out BPPV for the dizziness, that can wildly exacerbate symptoms getting like a quick adjustment.
Yeah, I'm sure.
And then from like sort of a functional kind of assessment of the brain, that is a huge sensory stimulus into kind of your proprioceptive kind of vestibular inputs. So I would just kind of be cautious about when I use them, but is it harmful? Is it bad? No, it's not bad. It's just in terms of how it might make you feel, it might flare symptoms more than you or the clinician was expecting.
Gotcha. All right, good to know. And what alternative therapies can complement conventional treatments for concussion recovery?
By most conventional standards, concussion recovery is integrative. So there isn't really a conventional management. We do not have a pharmacological drug for concussion. We do not have, like the standard treatment is really subsymptom activity and then subsymptom exercise, send people to visual vestibular therapy when indicated, send people to cervical PT when indicated. cognitive behavioral therapy when indicated. So the whole management of concussion and the most evidence-based way that we can treat it at this point is quote unquote integrative or alternative medicine, which is really awesome for me as an ND because like that's my sweet spot.
There
And
you go.
yeah, so my background was exercise physiology. I was in the fitness industry for 10 years. So it's like I get to just play with exercise and nutrition with folks, and it actually happens to be the standard consensus recommendation to do that anyway.
What are the top 2 or 3 things to do from a nutritional standpoint within 24 hours of hitting your head? Me, for example, I've had a history of some pretty severe concussions. Anytime I hit my head, I just become paranoid. So what I do is I run home. I'll start taking fish oil, high dose NAC, MCT oil, lion's mane, take all of those.
Yeah.
What's the literature research behind those supplements if helpful? And then in terms of a nutritional approach, should we be focusing on certain foods the first 24 to 48 hours? What are your thoughts on all of that?
Yeah. So if I were to break it up into categories of like food and then supplements. So talking about food, most of the research actually comes back to like a relative caloric restriction. And so like when we're looking at animal studies and like mice and things like that, if we cut calories by about 30%, we see faster recoveries and kind of better outcomes. And so for a lot of people, and this is no judgment, just for a lot of people eating kind of a standard Western diet or picking up fast food more than they'd like to admit, or DoorDash more than they'd like to admit, it's just kind of eat a little more fruits and veggies. That's kind of what it looks like because you're relatively displacing a lot of calories that way. So as far as a dietary approach, you'll see people push keto. You'll see there's a big push towards like paleo, carnivore type things right now. You'll see all kinds of diets. As far as concussion recovery, there's not like a concussion diet. So kind of what the research shows is that the more you can move towards like Mediterranean, paleo, or keto-ish, those are all going to have kind of benefits that are good for the brain. What I kind of push people towards is like Mediterranean-esque, meaning just like fruits, veggies, lean protein, healthy fats, whole grains, things like that. But I will also say, hey, do a time restricted feed. So try to do like a 12 to 14 hour fast, assuming you don't have any like diabetes or complications where you like need to maintain blood sugar. 12 to 14 hour fast puts you in a little bit of a caloric kind of, you're producing some ketones. And then if you're displacing a normal diet with extra fruits and veggies, there's a little bit of a caloric deficit there where we see benefits. So that's kind of how I think about food. Is I think about see if you can just eat a tiny bit less, and if eating less is a problem, just eat more nutrient dense, less calorically dense foods, which tends to be fruits and veggies. And then from a supplement standpoint, acutely, we've got some research. So basically, if you want to be like super evidence-based and like super blah, blah, blah conventional about it, there is no supplements approved for concussion, which is really silly. So when you look at data from like the military, or you look at animal studies, or you look at other human studies, we've got the kind of the big ones that consistently show up would be like creatine, omega-3s, curcumin. And then after that, you start to get more sparse. Magnesium is another big one. But I'd say the big four would be like creatine, curcumin, omega-3s, magnesium. The other one that can be really, really useful, like you said, like acutely, if you just hit your head, we've got a soldier like military study using higher dose N-acetylcysteine, NAC. That reduced, I believe that they were using high doses.
Was it 2,000 milligrams or something?
It was higher than that. It was like 4 grams. It was like 4,000 milligrams.
Wow.
And they were doing that for like, I forget the exact protocol, but it was like 4,000 milligrams, I think once or twice a day for like 2 days.
Yeah.
And then they lowered it. But they dropped, the NAC group dropped symptoms by 86% in the first week, whereas the control group only dropped by 43%. So 43% is still a good drop off, but like 86% is huge by taking NAC. And the idea there is just lowering oxidative stress. But as far as like my big ones that I like, it would be, if I were to kind of throw anything at folks, would be in the acute stage, some curcumin, manage the inflammation, some creatine, give your brain some extra energy, and some omega-3s, kind of as a dual inflammation, energy source, structural neuronal support. Those are the ones I like, because usually by the time people find me, we've missed that window where NAC is as acutely effective. So it's not a bad thing to take by any means. I still recommend NAC. But if I were to pick like the big three, creatine, curcumin, and omega-3s.
Yeah, a few weeks ago, I had a little volleyball incident. I started playing with a group of people after work on Tuesdays and just had an incident, ran into someone, both went for the ball. So immediately I went home and I had already heard about the NAC. So I just started dosing on that. And quite honestly, again, 2 days later, like I felt great. So I don't know exactly.
NAC is awesome.
Yeah, it really is. It is. Have there been any studies on 24-hour fasts, for example, following a concussion? Because I know that fasting is neuroprotective, and they
Yeah.
did touch on intermittent fasting, but what about like full-fledged 24-hour fasts?
I'm going to be honest, I don't know. I'd have to look. I could look that up and like message you, but for the purpose of this podcast, I'm not sure.
Yeah, I'm curious. I'd be curious. I've read some fascinating studies that also have shown that near infrared light can actually penetrate the skull to
Mm-hmm.
reach the brain and aid in recovery through like multiple ways, reducing inflammation, promoting tissue repair, all that fun stuff. What are your thoughts on that?
Yeah. So this is going to be kind of like a thought on like photobiomodulation, so like infrared light, but then also like HBOT and different kind of like niche type therapies.
Yeah.
I think they're awesome. I think they can do wonderful things like red light. I was just at a conference this last weekend where big portions of talks were dedicated to photobiomodulation and what we can do with laser and red light and near infrared. And it's really cool stuff. But if we're thinking about like a hierarchy or like a pyramid of what we should be doing in concussion, I think a lot of people jump to things like HBOT and photobiomodulation first when they've got to be thinking about like, well, how am I eating? How am I moving? How's my sleep hygiene? How's that foundation? Where I recommend it and where I kind of place it in folks' paradigm is like in conjunction with or after we've kind of graduated through these foundational steps. But yeah, there's really cool. There's one booth, Weber Technology. They've got like a full blown helmet that you can wear.
Wow.
And so I wore that not at this conference, but when I spoke at this conference last year. So when I was a speaker, I wore it last year, and it actually is cool. Like what you feel like. There's a little bit of clarity. This year I tried. You can do photobiomodulation IVs, so we can actually put light straight into your vein. And so you can set up a Y port where you can actually be dripping things like magnesium, B vitamins, carnitine, whatever you want to drip. But you can also be sending in red light or UV light or green light. And what was really cool is the green light kind of pushes nitric oxide and kind of pushes some of this, blood flow benefits. And that was one that I only had it on for 5 minutes, but I actually felt it. Like I very much felt that I had something different happening in my body, which was really cool.
Wow, that's crazy. I have like a small handheld Juve therapy red light that I use, and I just sat with it for like 20 minutes directly on my skull, and placebo or not, I did feel better.
No, yeah, there's definite benefits for using it. It's just the needle mover between, wearing a red light helmet or like actually regaining exercise tolerance. Like those are two very different things. It's not that it's not that the red light is bad. It's just you're going to feel much better getting back to 80% of your heart rate max than you would kind of waiting for that to happen.
No, that makes sense. I love this episode because selfishly, I have all these questions that I want to ask just that I've always wondered from my own history. But I've also heard that once someone has sustained a concussion, they're more likely to get more. What are your thoughts on that?
Yeah, so the research on that is kind of supports what you're saying, but also we've got other research that doesn't. And so the way to think about that, so like if we're talking about athletes, we've got research that says like as high as like 5 times the risk for like a repeat concussion or like a second concussion. But then what's not kind of factored in is like, well, who are the players getting concussions? What's their playing style like? Do they just tend to be more aggressive, risk taking, less risk averse type people? And so what you find in other data is when you match players by position. So like, I forget, I think it was a soccer study, but like, let's say I'm very familiar with ice hockey. Let's say we matched all centers and all left wings and all right wings and all right defense and all left defense. When you match them per player, there's actually not a huge difference in repeat concussions. And so it's kind of like, yeah, maybe. And where I think about it most, maybe like in the general population or someone who's not an athlete, where there's like a playing style to consider, is looking at sort of the recovery metrics that are less assessed but more durable. And what I mean by that is recovery metrics that aren't always looked at. So things like reaction time is not always looked at. Things like your actual center of pressure, like your sway on a force plate, as a measure of your balance. Those are sorts of things that if they're messed up, they're going to be messed up as long as they're messed up, which is weird to say because like if you look at a SCAT5, those symptoms and the SCAT5 assessment, the sideline assessment we use, that'll normalize within a week, whether you're normal or not. Whereas your reaction time will only normalize when your reaction time is normal. your force plate balance is only going to normalize when your balance is normal. So when we're thinking about repeat injuries, we've got to think about, well, does this person actually know where they're at in space? Does this person actually have a normal reaction time? Because again, thinking about acceleration, deceleration, you can, football players hit heads all the time without getting concussions. It's because they can match stiffness. They can create a contraction and create stiffness to minimize acceleration, deceleration at the right time. But if your reaction time is off or your proprioception is off, maybe that puts you at higher risk. So very long-winded answer to say, like, maybe that research exists, but there's probably some factors that we could look at in rehab before we clear people to maybe lower that risk.
Yeah, this may sound like a really silly question, but can someone have a concussion without necessarily having any symptoms?
I don't know. I actually don't know. The reason I say I don't know is because, so the reason I say I don't know, in the research, we'll say you have to have an impact, and then within 48 hours, you'll have symptoms. And if after 48 hours you have symptoms, we're going to attribute it to something else, probably not concussion, because concussion is this neurometabolic injury. There's stretching, shearing, excitotoxicity, this kind of cleanup phase, like excitatory and inhibitory phases. But the amount of people that I have that had a concussion or had like a concussion-like injury, a car accident, fall, something at their head, and then 40 days later had like just textbook concussion symptoms, I don't know what to make of that. So could they have a concussion and not know it? Probably not. It would just be the timeline of when those symptoms show up.
There's so much on that too, because I even heard someone else chatting on another podcast that someone had sustained a head injury and then didn't present with symptoms until like 2 weeks later. And in my mind, I was like, that doesn't necessarily make sense.
In my practice, when I see people like that, we typically find lots of issues in the neck, or we find, like with screening, like a PHQ-9 for depression or a GAD-7 for anxiety, we find that there's a significant mental health component and or a significant cervical spine component. And I think it's because of that whiplash injury. So maybe they didn't get concussion, but maybe like it took a while for this neck to really flare up and kind of eat at them.
That makes sense. Can we completely recover from brain injuries?
Tricky question. I believe we can. So I would say yes, especially
Good to hear.
Especially because, so a couple of things to think about. If it's an acute concussion and you get managed appropriately, like you had sideline assessment, you got exercise testing by day 5, and you kind of went your way through, we've got no reason to think that you're not recovered. Especially if you had, like, especially you're an athlete with a baseline test, like, well, your reaction time is back to normal. Your neurocognitive testing is back to normal. Your exercise testing is back to normal. You have no symptoms. So like, who's to say what's wrong? But then kind of these more chronic cases. So for me, I forget the exact numbers, but when I was doing like repetitive head impact research, I think it's like I played 13 years of ice hockey, and I think 9 or 10 of those years were actually full contact. Like I was actually able to body check, and people were able to body check me. I think I sustained somewhere between like 3,000 and 6,000 head impacts. And then 2 for sure concussions, and then 1 where, like, looking back, I'm like, yeah, that was probably a concussion. So it's like, okay, well, am I for sure at risk? Does my brain have problems? Well, so now we get into the nuance of like repetitive head impact and CTE and that sort of stuff. And when we look at those studies, if we did functional imaging of my brain, we would for sure find changes in the white matter. We would for sure find changes in structural kind of integrity. But when I do neurocognitive testing that I put my patients through, I always score kind of in the higher, tertiles, quartiles, percentiles, whatever. When I do force plate balance testing, I'm fine. When I do reaction time testing, I'm fine. So as far as neurocognitive performance, I'm fine. And that's what the research shows too, where people who played soccer, football, whatever, 90% of the data, like these big systematic reviews, 9 out of 10 times, they're still going to have normal neurocognitive performance. They're still going to have normal life. So then looking at recovery, it's like, well, is that recovered? Probably. And now let's get to like the next layer of nuances. When we're looking at CTE and we're looking at these chronic symptoms, CTE research is really, 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 really fuzzy and really, 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 really biased at this point. And I think popular media has kind of jumped the gun on really creating this one-to-one relationship between concussion and CTE and football and CTE. So when you look at that, there's a strong male bias. It's always male football players. And there's a football bias. It's always football players. So when you branch that research out, And you look at other sports. So like the initial studies were coming out on CTE, and it's like 99% of football players had CTE on autopsy. It's like, okay, well, that's scary. Let's look at other sports. So we look at soccer and ice hockey, and that number drops closer to 50%. And so now it's like every other. Well, now you look at other data and you find that people who never played sports also have CTE. And so it's like, okay, well, what's going on there? Well, then you look at all those people that had CTE and that donated their brain. They all had a pre-existing neuropsych disorder. They all had a pre-existing movement disorder. There was something else going on that also can create CTE pathology. So it's really tricky to say, can we completely recover? It's like, I believe so. Because when we're looking at recovery, it's just functional status living throughout the world. And I think, yeah, absolutely, we can achieve that.
Interesting. That's a good point, right? So like just from the physical perspective, you passed all the tests, you're at your quote unquote where you should be. What about long-term possible effects? So I've read a lot about development of dementia from several concussions, and dementia is not something that we can actively test for necessarily at this point in time or really see on scans. How do you explain the relationship with that?
Yeah, so that goes back to kind of the CTE conversation. And one thing we can throw in there is like when we look at, it was called like the NFL long study. And so we basically just looked at like, well, how are these football players doing after the NFL? Like, let's look at their lifestyle and let's look at their quality of life and symptoms they're experiencing. And we found that the NFL players that were eating like a diet high in fruits and veggies, sleeping more than 6 hours a night, and engaging in moderate to vigorous activity, so occasional like moderate to pretty intense exercise, they had significantly better quality of life, fewer symptoms, and like slower cognitive decline than NFL players who weren't. Now let's look at another study that came out, and they were looking at tau protein. So tau is one of the proteins that builds up in dementia. Hyperphosphorylated tau kind of builds up and we think causes problems. It might be smoke rather than the actual fire, but we see it associated with dementia. And they looked at physical activity levels in people with high, medium, and low tau. And they found that the more physically active you were, it didn't really matter the level of tau. It slowed your cognitive decline. And so when we're looking at NFL players relative to the general population, they actually tend to be healthier. When we look at sort of these lifestyle factors that influence cognitive function as we age, it doesn't seem to matter if you have a concussion or not. You still want to eat healthy. You still want to exercise. You still want to sleep. You still want to have social connection. So the research, to me, all that research is just really promising for a guy like me who hit his head repeatedly for over a decade, to say, well, hey, if I keep up focusing on sleep, mindful breathing, mindful eating, adequate hydration, I'm probably going to be fine relative to the general public, relative to anyone else who is at risk of dementia.
Right. No, I couldn't agree more. And I'm on board with you there. One area to that point, though, that I found really fascinating is that concussion symptoms are influenced by someone's pre-injury health. While no one plans for a concussion, just like you said, well, what are some steps that people could take to optimize their current health status, I guess, as a buffer to any potential concussion symptoms in the future?
Yeah. So there's a couple of things that I look for in athletes preseason that I can talk about, but generally everyone, athletes or not, physical fitness. So the better your aerobic capacity, the better your like cardiovascular fitness, typically the faster you recover. And we see that in animal data as well, where we like let mice kind of run on a wheel, or we don't let them run on a wheel. And we find that the mice who were allowed to run and the mice who did run recovered faster, better, stronger than the mice who couldn't exercise. And so it was kind of the first study to show that like pre-existing fitness helps out. But I see that also like in folks who are like even within athletes, like a softball player tends to recover slower than like my soccer or my hockey players. And I see it relate to how fast they regain exercise tolerance. So that's one thing that everyone could do, is just it applies to everything. Like if you're worried about cognitive decline risk, exercise is the number one thing we got for that. If you're worried about cardiovascular disease, exercise. If you're worried about concussion risk, exercise. From a metabolic standpoint, what I look at in my athletes is I measure vitamin D, red blood cell magnesium, and the omega-3 index. And so what I'm looking at there is I want to see that your omega-3 index, basically your red blood cell, we look at your red blood cell, we pull off the fats, and we say what percentage of those are omega-3s like EPA, DHA. I want that to be 8 to 11%. Most of the public is like 4%. I think most NCAA athletes are like 4.4-ish, but it's like half of what we want it to be. And that is where, like, your membrane is where you pull off inflammatory markers from. And so just by virtue of having more, I talk about it like Legos, like if you're borrowing Legos from the cell membrane, you want more anti-inflammatory Legos than pro-inflammatory Legos.
I like that.
And so I basically test in the off season or the preseason, hey, what's your omega-3 index at? Because that'll push how hard we dose an omega-3 or change up dietary things. A lot of times with my athletes, it's just saying, hey, I can tell you lied to me on your dietary intake and you eat a lot more fried foods and chips than you told me before. But and so we can tease that out. Yep.
Can't get past you.
The other thing is red blood cell magnesium. That one's usually deficient in people, but having sufficient magnesium can offset some of the excitotoxicity of concussion. And then vitamin D is one thing that when we see it's low pre-concussion, you can have more risk of kind of more significant or prolonged concussion symptoms. And we see that supplementing after the fact doesn't seem to help. So we want good vitamin D going into the injury. We want good omega-3s going into the injury. We want good magnesium going into the injury. So generally speaking, the more fit you are, the better your omega, magnesium, and vitamin D status. Typically, we can say the stronger your recovery is going to be.
Interesting. Question that just came to mind. Most of the literature seems to have been done on male athletes.
Yeah.
My question to you is, obviously concussion impacts cognitive function, emotions, hormones. Has there been much literature on women who have sustained concussions in terms of developing hormonal problems later on, like PCOS or other imbalances? And how can you definitively say that the concussion caused that? And then how do you deal with it afterwards?
Yeah. So yeah, there's a strong male bias and an athlete bias in concussion. We're getting better, where I'm starting to see more, age and gender matched groups in studies. What I will say is, we do have research coming out now. It's more like retrospective, like retroactive looking back, where concussion is associated with menstrual irregularities in the first year after concussion. And I think that comes back to, again, pituitary issues. It sits in the sella. So like when you accelerate, decelerate, there's a chance for that stalk to kind of stretch or have some kind of damage. Women also tend to have a sharper drop in progesterone after. And so I don't know if that's just because you have a relatively higher level than men. Like, again, hormone replacement isn't super my niche, or like hormone therapy isn't super my niche. But when we're looking at kind of gender differences, we see a significant drop in progesterone might be associated with women having more significant symptoms and more kind of prolonged symptoms than men. It also could just be that men are too tough guy to like actually say they have symptoms. So that might be kind of a flaw in the research. But yes, it's absolutely possible to have things like amenorrhea or, like altered kind of irregular cycles after a concussion. I don't know that we can at this point. I don't know that I say we as like the medical community. I don't know that we do correlate it to concussion yet, but the way we'd manage it would still be kind of very similar. In the integrative space, it's going to be looking at your liver health, your gut health, making sure you have adequate proteins and fats and sleep hygiene and kind of the normal concussion recovery anyway. In the conventional world, I know they'll just slap you with a birth control pill. I don't know that that's always the answer. Yep. My wife, Dr. Sarabala, has lots of ideas on that, so you should have her on here at some point. But
would love to chat with her on that.
But generally speaking, I know it's going to come back to sort of the same stuff we would look at in general, but making sure that there's a little more emphasis on that metabolic piece, that nutrition, kind of liver metabolism piece.
Yeah, no, that makes sense. And to that point too, let's say someone's bound to hit their head. Is there a quote unquote best place for them to receive an impact that's going to be least harmful? Like your forehead, the side of your head, the back of your head. Has there been any research on that? Because I've always been curious.
I don't think there's been research on where's the best place to get hit. I know that from football, like helmet sensor data, the kids that were more likely, like the athletes that were more likely to get concussion, the helmet sensor detected an impact on the front or the top of the head. So I know that this tends to be where people sustain the most concussions, but I don't know that it's better to receive it over here versus over here versus over here. We just know from helmet data that the front and the top of the head seem to be where football players tend to sustain the most. So maybe that says something about kind of extension or, whatever mechanics in in the injury, but I don't know that there's a best place to get hit. I wouldn't be like falling and like throw my head in a specific way on purpose.
Aim the right way.
Yeah.
Interesting. Do helmets actually do anything? And like even outside the context of football, for example, like bike helmets, like do they really protect against concussions?
They do nothing to prevent concussions, but they do prevent more severe injuries. So they do prevent like external head trauma, like a skull fracture or a more severe TBI, but they do not prevent concussion. And the idea comes back to this acceleration, deceleration. So the analogy that I use with patients is like, okay, so you're in like pretend like you clear out an old school bus, like you're going to remodel it for like, like a travel bus or whatever. So there's no seats in the bus. You're not wearing a seatbelt and someone drives that bus into a wall. What do? You fly around the bus. And it's like, okay, well now take that bus and wrap it in like 4, 8, 12, 20 feet of Nerf. It doesn't matter, like wrap it as padded as you want, drive it into the wall. Like you're still going to flap around inside. That's your brain. It doesn't have a seatbelt. And so it really comes back to being able to stop the acceleration, deceleration. So like the NFL right now is trying to create a quarterback specific helmet, and it doesn't do anything. It's just putting a bigger, I think the guy from the Concussion Legacy Foundation said it's like putting a bigger bumper on your car. And I thought that was awesome because that's exactly what I tell people. People hear me say that and they think I mean don't wear helmets. No, wear your helmet. You don't want something more severe than a concussion. Remember, a concussion in the grand scheme of things is mild. You don't want something worse than that. That would be terrible. So wear your helmet. Just don't expect it to stop this kind of functional injury.
To that point too, concussions are mild. What's the time frame where you would start to be more concerned if someone's symptoms aren't resolving?
Yeah. So when I say mild, I mean in the category of like mild traumatic brain injury. So people will say like I had a mild concussion, I had a severe concussion, I had a grade 2 concussion. We don't do that. It's just concussion. And then after that, it's like, what flavor of symptoms do you have? Are they more cognitive fatigue? Are they more migraine-like? Are they more vestibular-like? Are they more autonomic? Like what are you dealing with? And so if we had a textbook concussion, which I only really see in like 14-year-old little boys that have like nothing else going on in their life except for soccer or except for hockey. But what we would see is like a peak in symptoms. So like your symptoms would be their worst around 3 to 5 days. And then around 5 to 10 days, you start to turn a corner where symptoms will resolve. And then we see like normal everything tolerance, reaction time balance, and everything comes back in about 3 weeks, which is why I like a 3-week recovery. Where we don't necessarily worry, but where we start to say, yeah, this is for sure kind of heading into post-concussion territory, is if you've reached around day 10 and you haven't seen a change in symptoms, or they're still just as bad, or they're not getting better. Because once you hit day 10, that's when we expect a textbook concussion to go away. So if by 10 days you're still not better, well, then we for sure want to get you on that treadmill, want to run the VOMs, want to run, visual vestibular cervical spine testing to see, okay, why are you not recovering? And it doesn't mean that once you made day 10, you're not going to recover in another week once you start rehab. It just means that there's a reason we want to look in there and rehab you because those symptoms haven't gone away as expected. As an example of this, I had a guy who had symptoms for 5 years. And we got him back to work, back to like 0 on the post-concussion symptom scale in 3 weeks. And so it's like the duration doesn't matter. It's just turning over the right buckets and making sure that we've done the right exams.
Yeah, I wish I knew you sophomore year of college because I was out of class for about 4 months from a head injury, and I'm sure it would have been much less time had I come see you. Yeah. But I'm sure you're helping so many people. And my last question for you, Dr. Mark, is how do we balance also too the importance of physical activity and getting back into our daily routines with that risk of concussion? Because obviously when someone's experienced something, they're going to be more hesitant to get back into whatever caused the injury in the first place.
Yeah. One of the things and this might just be that I have, I may not seem it, I may not look it, but I was I was more of a gritty, grindy type hockey player. I was not scared. You could be 6'5". I don't care. I'm going in the corner with you. So it's kind of weird for me to give this advice, but when we look at the research, like there's this kinesiophobia, this fear of movement after concussion, whether it's your fear of dizziness, fear of re-injury, fear of headaches, fear of whatever. We find that the folks who can just kind of push through and continue to move and continue to do their normal thing, they end up faring off better. So that's one thing to think about kind of cognitively is like, well, I know if I move, I'm going to be better off. The other thing is just like, knowing if you've made it through rehab and you've made it through and you kind of graduated, it's like you've done everything you could and your brain is as healthy as it's going to be. And then at that point, it's just a risk benefit. So I have these conversations with athletes where if it is multiple concussions and they are happening easier, it's like, well, maybe we do want to hang up the skates or pick a different sport because I don't want you to keep hitting your head. But in terms of like your question of like daily activities and returning to physical activity, I encourage people to return to everything as normal as they can. Unless it's like this football player who's been concussed 5 times in the last 2 years. And then it's like, well, maybe get back to physical activity, but like golf or rowing or, something else that's not gonna hit your head. But in general, more movement is better for everything, for any body system you're looking at. Exercise is medicine. But just keeping in mind that like, even in BPPV and vertigo, it's like the more you can move, the better. And so in the concussion space, it's just reminding yourself, it's like, if it's going to happen, it's going to happen. So it's just the more movement,
so true,
the more you can play, like enjoy yourself.
Couldn't agree more. I love that. And I did misspeak. I have one last question for you. And that is, what does being well and strong mean to you?
Well and strong. I think it aligns really well with my like healthy on purpose tagline. I think just being well and strong, like just being, I really think about like physical autonomy, and that's where I like the concussion space, is because for a lot of people, I know I can get you better, and it's like a reset button. It's like suddenly people really appreciate that they can exercise, or that they can move, or that diet does really affect how they feel, or that sleep really does affect how they feel. So I think being well and strong, or being healthy on purpose, or like whatever kind of, I think it's just being able to do like what you want with your body when you want with your body, like just feeling good while you do it. And like that's what I want to help people achieve, is be able to exercise when they want, or be able to just do whatever how they want within their current capacity, but to be well and strong.
Beautiful response. Love it. Where can listeners find you?
I have a love-hate relationship with social media, but you can find me on social media. So I'm at Dr. Mark Heisig on, I think, everything: Instagram, TikTok, YouTube. I'm not on TikTok all that much anymore. I'm mostly on Instagram and YouTube. My website, just my name, so www.drheisig, so drheisig.com. And I try to be pretty accessible through those platforms.
Wonderful. And I will link all that in the show notes. Thank you so much for all this incredible information. I know it's going to help so many people. I wish I had it years ago, but we learned from our experience. Very grateful for you and all the work that you do, and excited to have you on again.
Yeah.
There's so much to talk about in the area.
Yeah, for sure.
I hope you enjoyed this episode. If you would like to support the show, please subscribe, leave a rating, and share it with others. Be sure to visit WellnStrong.com to access notes from the show and to stay current with new content. I'm so grateful you joined me. Be well and be strong.